Welcome to Wednesday's edition of COVID-19. Korea has recorded yet another high today with daily infections above 1,700. Now, the Delta variant is expanding its presence here on the local front, but elsewhere, another variant, this time of interest, is seeking to take root. We have details later on the program. Here first is our Kwon So-ah with the broader pandemic coverage. Now, So, let's start with the alarming surge here on the local front then.
Sunny, our daily caseload has jumped by more than 500 infections compared to yesterday. So the entire nation is on high alert now, with infections not confined to a particular area. And it's also for the first time since the fourth wave here in the nation has hit that outside the metropolitan region, we are seeing more than 500 infections. So here's the record high figure we're seeing, 1,784 as of 12 a.m. this Wednesday. And with that, we also have over 1,700 domestic transmissions, with 58 cases categorized as imported cases. Triple digits across the capital region. The capital Seoul went from the 300s to 600 this Wednesday. Also, Gyeonggi province from the 3 to the 400s, and even Incheon recorded over 100 infections this Wednesday. Also a concern down here in Busan with a triple-digit figure, more than 100 infections there. So a little less than 70% of cases have broken out in the capital region. And with that, for the fourth straight day, the non-capital regions also accounted for more than 30%. Now, in the past week and also for the past 2 weeks, to be exact, we have more than 1,000 cases for 15 straight days. And even considering that today is a Wednesday when usually numbers tend to peak, if you compare the Wednesday figures throughout the past weeks, we are seeing a gradual surge, even 170 more cases compared to last Wednesday. And with that, the total number of cases in Korea has surpassed 182,000.
Right, and so this fourth wave comes at a rather unfortunate time here, with officials calling for extra caution, right?
Right, Sunny. Officials are saying that we are currently at a very grave situation, and there are also especially worries of more increased movement across the nation, with elementary, middle and high schools soon to go on summer break.
The peak summer vacation season in late July to early August is expected to be most critical time. A pause is what we need right now. I ask you to enjoy your summer break while maintaining social distance instead of gathering with others. Businesses and workers should stagger their vacation schedules and abide by prevention measures.
So given this situation, there is a high possibility that the toughest measures of social distancing, or level 4, in the capital region will be extended past this week. Meanwhile, beginning this Wednesday, Busan has raised its social distancing level to level 3. Also, some other places in Gyeongsangnam-do province are under level 3, while the city of Daejeon is expected to be under that level beginning on Thursday.
I see. And the virus-hit naval unit has safely returned to Korea, but more members tested positive upon arrival, So.
Right, Sunny. The Cheonghae unit arrived by special flights on Tuesday evening, early evening, after which all members underwent another round of PCR tests, and 19 more people tested positive for COVID-19. So with that, a total of 266 members have been infected, which means 88% of a total of 301 members of the unit that were on a destroyer off waters of Africa for a months-long anti-piracy mission. All service members have been immediately sent to designated treatment centers or hospitals upon arrival. 14 have stronger symptoms than others and need treatment, but there are reportedly no patients that are currently in critical condition. 23 people tested negative, while test results of 12 were said to come out later in the day. Now, following this incident, officials have vowed to do more efforts in vaccinating those who are serving the nation. And speaking of vaccination, with almost 150,000 people who got their first dose of COVID-19 vaccine yesterday, and more than 45,000 who got fully vaccinated, we've now got 32% of the nation's population that got at least one dose, and 13% that are fully vaccinated. Now, let's move on to to international updates. As the COVID-19 situation in neighboring Japan is not improving yet, uncertainties linger even days before the Olympics events. 71 people so far linked to the Games have tested positive for COVID-19. And according to Japanese media, there is a possibility that less than 20 state leaders are to attend the opening ceremony for the Games. Let's also check the figures abroad. We've got the U.S. with 35 million infections in total, where now 83% of cases are said to be the Delta variant. And India's total number of cases at 31.2 million, but the death toll here is said to be officially at around 418,000. But now reports are saying that might be at 4 million. This is according to latest reports, while Russia has hit the 6 million mark in total infections. And Indonesia, still seeing resurgences with 2.9 million cases, has decided to extend its lockdown until Sunday. Last but not least, the total number of infections around the world stands at 192.2 million. And those are the updates I have for now, and I'll toss it back to Sunny.
Right, so thank you for that. I'll see you on Thursday. Right, now for more local COVID-19 coverage, I have our G. Abby Lee here in the studio with me. Welcome, G. It's been a week.
That's right, Sunny.
And what do you have for us today?
Today I have the key highlights of Tuesday's KDCA briefing, from the cluster infections outside of Seoul and the update on the rallies contributing to the spread. Last week, the Seoul metropolitan government came under a lot of heat for not being able to contain the spread of the Delta variant. While the national infection rate is not showing any signs of slowing down, the virus is now spreading faster in regions outside of Seoul. Korean health authorities explained bars have been the main drivers of cluster infections in areas outside of the capital region since May. Now, from May until now, 38 new clusters have been reported, infecting nearly 1,800 people. Here's a clip from Tuesday's briefing.
이들 집단 사례는
These cluster infections were fueled by infected individuals who continue to visit crowded venues and show up to work. The transmissions mainly took place in places with poor ventilation, where people were singing and consuming alcohol.
Right, and I believe Director Lee also underscored the importance of continued commitment to COVID-19 prevention among members of the public.
Exactly. The KDCA said the risks involved with catching COVID-19 should not be taken lightly by anyone. Here is KDCA Director Lee Sang-won again.
우리 사회는 오랜 기간
Perhaps we as a society have gotten used to the coronavirus after dealing with the pandemic for an extended period of time. But COVID-19 is not a minor ailment. It propagates faster and is more likely to trigger super spreader events compared to influenza.
Also, compared to the flu, COVID-19 is more likely to result in serious illness, even for those under the age of 60. At least 1 out of every 100 people infected with the virus needed critical care. The KDCA emphasized the risks associated with COVID-19 infections and its complications have not been studied in full. Not to mention, more time is needed for experts to study the long-term effects of the disease. As those over the age of 60 have mostly been vaccinated, only 1% of those infected in that age group needed critical care. On the contrary, there are a growing number of infections, hospitalizations, and deaths among those under the age of 60, hit by the government's policy to prioritize the elderly when it comes to inoculations.
Right, which goes to show that all remain vulnerable to COVID-19 in the absence of vaccinations, right?
That is correct.
Now, meanwhile, Korea's largest labor unit is poised to hold massive rallies despite the record levels of infections here.
That is correct, and that's in addition to the earlier rally that held in the same month. So the Korean Confederation of Trade Unions, or the KCTU, is scheduled to hold 2 large-scale demonstrations this Friday and the next. Some 1,200 and 3,000 people respectively are expected to show up. The KDCA, as well as Prime Minister Kim Boo-kyum, said this morning the union should cancel the rallies and submit the list of participants who are at a previous rally held earlier this month. The rallies are being held as a show of support for call center workers at the National Health Insurance Service who are currently on a strike. The rallies will take place in the city of Wonju in Gangwon Province, where the headquarters of the National Health Insurance Service is located. Level 2 social distancing guidelines are currently in effect in Gangwon province, which comes with a ban on all events and gatherings involving 100 people or more. That's all from me today.
All right, as always, thank you very much for the coverage.
Thanks for having me.
Right, cluster infections at department stores here in the metropolitan region have directed the spotlight to shared public spaces such as restrooms and their possible role in the spread of COVID-19. Do take a look.
The Seoul city government recently issued an administrative order under which all managers and workers at 32 department stores to take preemptive COVID-19 tests as a precaution against further cluster infection at the stores. Recently, a cluster COVID-19 infection was reported at a department store in Gangnam-gu district despite its thorough implementation of quarantine. All workers were required to wear face masks at all times, and individual partitions were installed in the cafeteria. Yet, despite all these efforts, a group of department store employees contracted the virus.
아무래도 지하 식품점부터 유행이 시작이 됐고 또 그 종사자들 간의 공용 공간을 같이 쓰고.
On July 8th, local health authorities said that the virus could have spread in common spaces such as changing rooms, smoking areas, and bathrooms. Among them, experts pointed out bathrooms as the cause of a cluster infection.
Name places where you visit literally every day, and one of them must be bathroom. Public restrooms are especially cause for concern for transmitting COVID-19 because they experience heavy foot traffic.
In fact, this is not the first time public restrooms have been identified as vulnerable to a COVID-19 outbreak. They have been blamed for 36 infection cases at a hospital last year and for outbreaks in cramped schools and small residents. Similar cases have been reported outside the country too. In January this year, Japan's NHK reported that 49 subway workers were likely to be infected through faucets. Health investigators in Thailand identified the turnstile at the entrance of the public toilets as the suspected source of 867 COVID-19 cases.
이제 마스크를 벗는 상황들이 이제 가장 많이 벌어지는 게 이제 제가 보기에는 화장실이 가장 대표적이거든요. 뭐 식사하고 뭐 양치질을 할 때 당연히 이제 마스크를 벗어야 되고 뭐 이런저런 이유로 뭐 세수를 하기도 하고 하면서 그런 이제 마스크를 벗었는데 그 뭐 무증상 감염자라고 할지라도 뭐 그런 상황에서 그 화장실에 있는 수도꼭지나 아니면 주변의 공용 물품이나 손잡이나 이런 부분들을 이제 오염시킬 가능성이 상당히 많고요.
The virus can survive up to 3 days on plastic and stainless steel surfaces. So if you touch the contaminated object, you are at a high risk for getting COVID-19.
과거에 그 이제 일본에서 이제 초기에 다이아몬드 프린세스라는 이제 유람선에서 굉장히 많은 확진자가 나오지 않았습니까? 근데 그 대다수는 사실 사람들끼리 별로 접촉이 없었던 사람들입니다. 각각의 이제 공간에서 흐트러져 가지고 격리하는 상황에서 계속 확진자가 나왔는데 그건 결국은 공용 공간에서 만지는 과정에서 접촉 감염으로 일어났던 그런 거로밖에는 설명이 되지 않거든요.
Public restrooms are deemed risky because they are used by a lot of people. So to prevent infection risks, it is important to follow basic quarantine rules. You should always wear a face mask every time you use a public bathroom. Keep a distance of at least 1 to 2 meters and wash your hands with running water for 30 or more seconds.
화장실을 관리하는 그 관리자 측면에서도 정기적으로 화장실에 대해서 손잡이라든지 수도꼭지라든지 이런 부분들에 대해서 정기적으로 살균 소독을 해주시는 것이 그 공용 화장실을 위생적으로 관리하는 가장 효과적인 방법이라고 생각을 합니다.
Now, some may ask questions whether it is possible to get infected by using the soap placed in public restrooms. And simply speaking, the answer is no. First, the virus cannot survive on the surface of the bar soap. And second, though it does survive somehow, surfactant, a component of soap, will destroy viruses while washing hands. South Korea is experiencing a full-scale fourth wave of COVID-19, and it has sparked concerns among people. To overcome yet another crisis, we should remember nothing is more important than following basic hygiene rules and quarantine guidelines. This has been 신새벽.
On the international front, there is another variant that is receiving much attention, especially in South America. The Lambda variant that was first identified in Peru late last year has since spread to several countries, including Argentina. For more on this, I have Anita Sarah live on the line. Anita, welcome.
Hi, thanks for inviting me to your program.
Right. Anita, let's start with the presence of the Lambda variant over in Argentina. When was it first reported there and how widespread is it?
Yes, so this variant appeared first in Peru, and as you say, it is one of the most important today in South America. It appeared in Argentina around February. We have here a project called Proyecto País, the country project which is investigating all the variants we have in Argentina. And today, the Lambda variant is around 37% of the cases we have in Argentina, like the Gamma variant, also known as the Manaus variant. But the Proyecto País, the country project which is doing this investigation about the variant we have in Argentina, so far they didn't find yet a relationship between Lambda and increased ability to evade antibodies compared to other variable of the coronavirus.
I see. Now, the global health body, Anita, has yet to include Lambda in its list of variants of concern, but you say officials also have yet to find out more about the transmissibility of this particular variant. But how are they seeking to stem its spread?
Well, it's a bit a stretch moment here in Argentina because we are more in a reopening moment, both on the with the national government, but also the local government in Buenos Aires or the provinces. So the bar and restaurants are open, and we have the sensation that the second wave is behind us, and we are more thinking maybe when a third wave could arrive. So we are in this national moment, but we are more worried about the Delta variant, and that's why, in an international perspective, the government here is trying to secure the border. So, for example, they just allowed 1,000 people a day to come to Argentina through our international airport to control the spread of the Delta variant. At this time, we have some cases, but there is not a community spread in our territory. So the focus of our attention at this moment, it's much more with the Delta than the Lambda, because the Lambda is already part of our daily life here in Argentina.
I see. And also Argentina recently hit a grim milestone, Anita, with over 100,000 losses of lives to COVID-19 since the start of the pandemic, that is, of course. What appears to be raising the death toll there?
Yes, it has been a hard moment for us, and also because half of these deaths happened after March 2021. So until March 2021, we just have 50,000 deaths. So the second wave has been really impactful here in Argentina. And regarding this, we have several explanations. As the health minister, Cara Bisotti, was explaining, we have a country with a difficult economy, and the first lockdown last year has been very long. So it has been difficult for many people to respect the measure because of the need to work, of the need to put food on the table of your family. And also we have one of the biggest cities in Latin America. So this urban agglomeration is the worst in terms of isolation, especially because also we have some slums, so to be isolated or to respect the social distance in this condition, it's quite difficult. And also because we had this lockdown, a certain fatigue started to appear in the population. So even if the government were trying to take some measure to contain the spread of the virus, the reality in the street, but also in the intimacy with the private reunions and meeting of family or friends, has been also important on the impact of the number of deaths.
I see. And against that backdrop, Anita, what can you tell us about Argentina's vaccination drive, which began late last December with the Sputnik V and has since included Sinopharm and AstraZeneca to its arsenal, right?
Exactly. Yes, we start with the Sputnik for the essential workers, especially the health workers. And also because we had no school for 1 year, so when the government decided to go back to the school, not in a virtual mode, but in the school, they started also to vaccine the teachers and after the population. So after Sputnik, as you said, we received AstraZeneca vaccine and Sinopharm, and recently we also received Moderna vaccine from the US, more than 3 million, but we don't have yet a vision on how this vaccine will be distributed in the country and to which population of the country. But as an example, now in Argentina, in the city of Buenos Aires, they started to vaccine people over 25 years old. So, and in the rest of the country, it's going quite faster than in the city because we are a lot here.
I see. Anita, and what has been the public response to vaccinations? I ask because President Alberto Fernandez tested positive for COVID-19 back in April, despite being fully vaccinated with the Sputnik V.
He had, when he get the COVID, he had the first shot of Sputnik. So he gets sick on April 2, and he received the Sputnik V first shot on January. So I think this contributes also to share how the vaccination is important with the population, because he has been asymptomatic. So he just get isolated as the protocol required, but he didn't have many other problem with the COVID. So, and also now in several regions of Argentina, local governments, but also people of the community are trying to encourage people to get the vaccine, especially because we are fearing a lot the Delta variant. So the plan is to have people vaccine before the community transmission of the Delta in our country.
I see. All right. Anita, before you go, very briefly, could you tell us a bit about some of the stories you plan on covering in the future with regard to COVID-19 there in Argentina?
Yes, I've been working and I continue to work and to follow different topics here in Argentina in a long-term project, like how the pandemic impacted the tango community and the tango workers in Argentina. It's a really important dance and culture for people here and for our economy. But I also focused on the workers, like the domestic workers who have been impacted a lot by this pandemic because they have a precarious condition of work without legal contracts, and they have suffered the lack of income for so many months. So they're the topic I continue to follow thanks to the support of National Geographic and the Pulitzer Center.
Right, I see. All right, Anita, do stay safe, and thank you very much for making the time to join us live at this hour with your thoughts.
Thank you. Take care.
esta vez tenemos mezclas, ¿ya? Yo te diría que más o menos un 70-80% de las camas está usada por COVID y el resto son las patologías habituales.
세계 여러 나라에서 백신 접종이 본격 진행되고 있지만은 최근 WHO는 전 세계가 코로나19 3차 유행의 길목에 들어서 있음을 경고하고 있습니다.
In our session today, we shed light on the Lambda variant that has been expanding its presence over in Latin America. For more on the situation there, I have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
And I also have Professor Sarah Ok-shin from Korea University. Good to see you again, Professor Shin.
Good to be here.
Right. Meanwhile, joining this session virtually is Professor Nathaniel Landau at New York University. Pleasure to have you with us, Professor Landau. Right, Professor Shin, we'll start here. The World Health Organization has labeled the Lambda variant as a variant of interest. What is the meaning of this label?
So the Lambda variant has been here with us for a while, actually. It was first detected in Peru last year of August. So it has grown to be dominant in Peru. So just last month, WHO has announced that Lambda variant to be a variant of interest, joining other variants like Eta, Iota, and Kappa variants. And variants of interest is considered to have these genetic changes or mutations that could affect the virus characteristics, such as how transmissible it can be or how severe it can cause symptoms in people, or how well it can escape the immune system, or how resistant it can be against the vaccination. So this variant of interest may pose a potential risk so that they need to be closely monitored. But still, a variant of interest is one step below a variant of concern, which includes alpha, beta, delta, and gamma variants that are already circulating globally. So the Lambda variant doesn't qualify as a variant of concern yet, but given that it's already detected in 30 different countries, and we have seen these serious situations in Peru, it could definitely have the potential to become a variant of concern in near future.
Right. And speaking about variants of concern, Dr. Kim, COVID-19 variants of concern have emerged from the UK, South Africa, Brazil, and India. Is there a connection between the birth of variants and perhaps the level of contagion in a particular place?
I think so, and actually the countries experiences just a large viral load, like a huge rampant viral spread. Actually, somehow develop some emergence of new variants. I think it's on the community level, where when there is some high viral load, there is more chance of emergence of new variants. And also another thing that we can actually think about is that those countries also is earlier in the COVID-19 pandemic, they actually experienced a huge number of confirmed cases, which means that many people actually experienced the natural infection. And as a result, in spite of their recovery, they develop their immunity. But then the immunity actually wanes over the time. So the immunity, when after a recovery, and then their immunity may be very strong, but it actually becomes weaker and weaker over time. But this time, when they infected with these viruses, then the viruses maybe perhaps experience a little bit of selective pressure. Instead of just being destroyed by the immune system, now just a weaker immune system, the virus somehow survives under some selective pressure. So there might be some chances of their developing some emergence of new variants, which is actually now in this case escape mutation, especially against the immunity.
I see. And Professor Landau, the Lambda variant has been reported in some 30 countries, as Professor Shin pointed out, including the US and the UK, since its initial finding in Peru late last year. What are your thoughts, Professor, on the speed of its spread?
Yeah, I would echo what the previous speakers have said, that the virus does seem to be more transmissible than the earlier forms of the virus. We haven't done real careful studies yet. Large-scale studies have not yet been done on this variant, but if you look at the rate of increased prevalence of the virus in Peru, you can see that it really shot up just over the past few months, so that the large majority of infections in that country are from Lambda. So it does have increased transmissibility. Whether it has increased lethality or symptoms is not quite clear yet. But there's no reason to think that it's any worse than, say, the Delta virus, the Delta variant, and perhaps it's not quite as bad as Delta, one would at least hope. So while this is a dangerous virus, it's not something to get panicked about.
Right. Professor Shin, what can you tell us about the possibility of reinfection with variants such as the Lambda or Delta and their potential evasion of protective antibodies that were generated from a previous infection?
Yeah, so when you think about the president of Argentina case, so he has received the Sputnik Russian vaccine, but he has gotten the Lambda infection. And so this seems to be the case of breakthrough infection. Fortunately, he has had a mild symptoms and he's fully recovered. But that's probably due to the prior vaccination he has had. So given that, you know, there are some data to suggest that Sputnik's Russian vaccines do offer pretty good protections against the multiple strains of COVID-19, I assume that the vaccination may have protected the case of the president of Argentina, not to have minimized the symptoms and have mild symptoms instead. So I believe that vaccine-induced antibodies do still a good job of neutralizing various types of variants that are circulating right now. But even though no vaccines do offer 100% protections.
Right. Dr. Kim, how do you respond to claims that the COVID-19 virus mutates slower than the seasonal flu virus?
Well, according to some early sequencing analysis, the SARS-CoV-2, this is the causative agent of the COVID-19, is actually making two mutation per month, which is actually this mutation rate is actually half of the influenza virus, and also a quarter of the HIV, which is a causative agent of AIDS. And these, the SARS-CoV-2 and then influenza virus, also just RNA viruses. And then the RNA virus is actually known to have a very high mutation rate. But then the reason that SARS-CoV-2 has a lower mutation rate compared to other RNA viruses is that this virus has some very specific enzyme, which is called, actually have a proofreading function. What it means that if there are any viral RNA polymerase and it incorporates some mistakes when replicating, then this proofreading function actually repair such a mistake. So then generally mutation rate is fairly lower with the coronaviruses. So that's pretty much a known fact. And then what it means that in terms of our a response to the COVID-19 is that maybe our vaccines and the therapeutics compared to some those against the influenza viruses may be less vulnerable to the such kind of the mutation, because probably less occurrence, more fewer occurrence of the escape mutation and the resistant mutation as well.
Right. Meanwhile, Professor Landau, I hear you've been involved in research about the efficacy of our current vaccines against the Lambda variant. What can you share with us?
Well, the Lambda spike protein, that is the part of the virus that sticks out, and that is what antibodies bind to, has 7 mutations, so 7 changes in that spike protein that are different from the earlier viruses. And so those changes do 2 things for the virus. They allow the virus to stick more tightly to target cells, like to the cells of your lung. That makes the virus more infectious. At the same time, those mutations are what the antibodies bind to. And so if that part of the spike protein is now altered in the lambda protein, now the antibodies don't bind as well. And what we've been finding is that, yes, when people are vaccinated with the currently approved vaccines, the antibodies don't work quite as well against lambda. In addition, they don't work quite as well against Delta or the other variants of concern. But the point that we want for people to understand is that even though the antibodies aren't quite as good, they are good enough. That is, they will keep you protected, or they will keep the large majority of people protected from getting infected. And even if they don't totally prevent you from getting infected, when you do get infected, the disease will be quite mild. Like, it's not going to put you in the hospital, and it won't be lethal. So we think it's good news that vaccines so far are able to protect quite well against all of these variants.
Professor Lambda, I understand this is an impromptu question, but how would you compare the level of protection given by vaccines as compared to the level of protection perhaps from a previous illness or a previous infection of COVID-19?
Right, so we have looked at that, as have many labs, just looking at how good are the antibodies in a person who's been vaccinated as compared to a person who was naturally infected. And what's really remarkable is that you have much better antibodies if you got the vaccine than if you were previously infected. Now, the previously infected person is also most of the time protected from reinfection. And what that's telling us then is the vaccines are giving really good protection, even better than having caught the virus.
Right. Professor Shin, what are the chances then of being affected by two different variants simultaneously, as was the tragic case over in Belgium of a woman in her 90s who was not vaccinated, though?
So actually, it's very common to see co-infection cases with COVID-19 with totally different viruses like respiratory syncytial virus or rhinoviruses. A study from Stanford found that a quarter of actually SARS-CoV-2 infected people actually have been co-infected with other respiratory viruses. But the case you have mentioned from Belgium, it's a very rare case actually. This 90-year-old woman, she was not vaccinated, I believe, and she has caught this alpha and beta variants. So this is very unusual case because variants do compete with each other for dominance, and a single variant may be dominant at a given time. So, for example, the spread of Delta variants may lead people to believe that Delta variants are can outcompete the Lambda variants. So at this moment, but we don't know whether Delta variants can outcompete the Lambda variants because we still don't have careful studies, or we don't have the in-depth studies yet about how transmissible the Lambda variants might be.
Right. And Professor Landau, as Professor Shin has just said, information about the Lambda variant is still evolving. And having said that, though, what are your prospects of this particular variant, the Lambda variant, becoming the dominant strain across the globe in the near future?
Yes, I believe that's very unlikely. And I think that's what most scientists would say. The Lambda variant has been present in South America for quite a few months. It has spread at low frequency. Say, it's present in the United States, it's present in low frequency in many other countries, but it doesn't seem to be sort of taking over the way the Delta variant has. So I don't think that's going to be a major concern.
Right, that is quite comforting to know. Professor Shin, meanwhile, Korea has yet to report a single case of the Lambda variant. What efforts do you propose to keep this variant at bay? here on the local front?
Yeah, so there just hasn't been enough studies yet about the Lambda variants, so we cannot really draw the strong conclusions yet. So we need to do more studies on, how transmissible this variant is and how severe it can cause the disease and how resistant it can be to vaccinations, large-scale studies. But the situation in Peru definitely raises concerns about the Lambda variants. But I think as Dr. Lando's study suggested, the current vaccines can still remain to be effective against the Delta or Lambda variants. So we can have, our majority of population to be vaccinated as soon as possible. That would be, the best thing to do. And also we have to learn from what's happened to us with the Delta variants, right? Because we are in the fourth waves of epidemic because of, these Delta variants emergence in Korea. So knowing this kind of prompts us to really get vaccinated as soon as possible so that we can be protected against the Delta and other emerging variants.
Right. Dr. Kim, what's your take on the efficacy of our current treatment options against the Lambda variant?
Well, as Dr. Lando said, there are some number of just mutations observed in the some spike gene. And then not only just the Lambda variant, but other variants are known to just have the multiple just mutations on the some spike gene. And there are some other outside of the spike gene. So, but then most of them are the spike on the spike gene. So what it means that is the spike is the target of all the vaccines, and then now on the monoclonal antibody. So the if we use like a neutralizing antibody, for example, like some Eli Lilly, Regeneron, and Celltrion, and then Vir Biotechnology, they are using the neutralizing antibodies, and then their neutralizing efficacy may be just decreased due to the some of these mutations. But then we think so, but we need some experiment, just a demonstration of such any decreased efficacy of monoclonal antibodies. But then the other treatment options, they are not approved yet, but some are actually being just developed under some clinical trials. They are targeting mostly RNA-dependent RNA polymerase, some other proteases and other host factors. They are less vulnerable to the mutations on the spike gene. So if they are successfully developed, this would be some alternative just countermeasures for these variants.
I see. And Professor Landau, what are your words of advice with regard to perhaps future efforts to fight COVID-19 amid the presence of variants?
Right, and it's likely that we will see additional variants in the future. There's no reason to think that we've seen the end of all the variants, but in a way, it's not such a big concern as long as these variants can be neutralized by the vaccines. That's what's really important. It is conceivable that a virus might emerge that would escape the vaccines, but that has not happened yet so far. So I think, what everybody will agree on is that the key is to get vaccinated. And, the more people get vaccinated, the better it's going to be. The numbers in Korea are still relatively low, and it will be important to increase that vaccination rate as quick as possible with whatever vaccines are available. And people should be educated and realize that that's the way out. Of course, masks and distancing, that will help. But, once you get the vaccine, you don't have to worry about those things as much. It's a really liberating thing. And, it doesn't hurt. The side effects are very minor. The vaccines are quite safe. And that's really the key to this whole thing.
Right. And Dr. Kim, staying with efforts, of course, to contain variants and COVID-19 generally, please do remind us about the importance of genomic sequencing.
Well, currently, just the genomic sequencing is the best way to detect the variant. And then one of the reasons we cannot actually catch up with the speed of the just emergence of variant is that our just typical just RT-PCR-based diagnostics do not just detect the variants. But for the detection of this already known variant and also some unknown variant, we need just a sequencing. But this sequencing needs more money and more time to get the result. But we actually somehow just overcome this hurdle. And then I think once we got some sequence information of this variant, there might be some other companies and the labs to just develop some better just diagnostic tools to just measure and then quantify those variants in the specimens of the confirmed cases.
Do you think Korea is spending quite a bit of attention and setting aside that is importance on the genomic sequencing, or do we need to do more?
Currently, I think Korea is not really, that's a best case scenario, compared to the UK and then some other countries. But I think our government authorities doing some very huge effort, and then they are somehow implementing such kind of measures.
I see. All right, Dr. Kim, thank you very much for your thoughts. And Professor Shin, thank you for being with us today. And Professor Landau over in the US, thank you very much for your time and your thoughts.
Yes, thank you.
Right, infections outside of the Greater Seoul area have been rising in recent days. Accordingly, authorities are calling on members of the public to refrain from unnecessary ventures outdoors. Thank you for watching.